just so that if there are any questions and see what you remember from last week. Yeah? So, we were looking at how services are provided within extension to provide support for innovation. And some of that's all taking place within the context of a long history of how extension's been done within the context of development. But there are different factors that influence it. Things like the political structures. And right now, after having a huge shift from large government-run institutions, we're seeing more of a shift to decision-making taking place lower at the food chain. We're seeing a lot of decentralization in some places and a lot of reconcentration in others. So changing governance structures. One of these things that comes up is decentralization. You can see, for instance, Malawi has a decentralized extension system. Uganda has decentralized a lot of how decisions are made. And there are different types of decentralization. We've got political decentralization, where you've got political structure and how decisions are made and where they're made at the level. You've got administrative decentralization, and we went through deconcentration, delegation, and devolution. It means where the decisions are made and how, for instance, are we talking about local level officials, are we talking about regional councils, who has the ability to decide what money is spent. There are different shapes of decentralization administratively. There's fiscal decentralization, so the money, where money is spent and the level at which it's spent is different. So if you've got a very centralized system where the national government decides how money is spent for an extension system, that's one thing, whereas you could have regional offices and the regions are deciding how money is spent. You can have a lot of regional differences as a result. Does that make sense? So there are different ways that the money decision making is meant. And then there's economic or market decentralization, where you try to get more services provided by the market. This can be by privatizing them and creating services that were once public, they're now private, meaning people might have to pay for them, or perhaps the government contracts a private institution to deliver it for them. We certainly have seen that in some of the ways that extension and support for farmers has been delivered in some Western countries. And there's been a push towards more privatization, towards taking the costs of service provision and giving it to the people who are using the services. Or there could be deregulation, changing ways that regulations work. The rules change so that perhaps where it was only a particular service provider, the regulations are shifted so that there can be multiple service providers. Yeah? So it is creating incentives for the private sector to take up service provision. People argue that, or the arguments for decentralization, one is that there are local decisions for local situations. If you've got decision making and money being spent at a very local level, what's going on in that particular region will be paid attention to. And especially when we've got huge countries, for instance, where, Cameroon has, 5 agroecological zones, from rainforest to, is it desert? Is it desert? So you've got hugely different systems. What's going to be, all right, everybody turn your phone off. That's the third one, you're not the only one. I hear these things. When you've got 5 massively different zones, how is it that the extension needs of someone who's farming in a rainforest are going to be very different from someone who's farming in a desert? So the idea that decentralization could offer decision-making that takes place at the local level, so it's much more appropriate. That's one of the arguments. It could be that there's more accountability, more access to the people who are supposed to be making decisions and spending money. So if you've got local governments are in principle easier to access than national governments, or you can get access to your local member of parliament more easily than you can the Minister of Agriculture. In some cases that isn't true. It depends on the country. Because different countries, every time I'm in Sudan, it amuses me to no end, because everybody's friendly. friends of everybody within the extension system. So it's not possible to talk about one person without them knowing everybody else. So actually the Minister of Agriculture is relatively easy to access because he was taught by one of our co-investigators. But in places where you've got a huge geography, that would be a very different story in Nigeria, for instance, which is a rather massive place. So that in principle you should be able to have better access, and elected officials at a local level are supposed to be more accountable to people if they are closer to the ground. It does cost less for the central government because the costs shift to the local level. So it could be that, I mean, recycling within Reading is done by the councils. You can see very different levels of service provision. My council collects rubbish every 2 weeks and recycling every 2 weeks. I was once in a Wokingham borough and they collected glass as part of their recycling program, whereas in Reading they won't. Because one is more expensive than the other. I think it's a cost. When they talk about, when they've gone some places in the UK, get weekly rubbish collection. The cost becomes an issue depending on the council and how many people. Same sort of idea. But the government, the national government, isn't responsible. So it becomes cheaper for national governments and more expensive for local governments. If you've got the resources and the tax base, it can be fine. But if national governments are trying to save themselves money, that is one of the arguments that they make. There's also the argument that there can be better local coordination. So if you've got, instead of having a whole bunch of ministries doing things at a national level in a community, you have people within the same level doing work in the community. So there's supposed to be better links between individuals. This isn't necessarily individual agencies who are working in the same geography. It isn't necessarily the case. One of our current PhDs, Claudina Chawa, is looking at extension service provision in Malawi within the context of decentralization. And she's saying, is pluralism actually getting better services to farmers? One of the things she's found is that there's a lot of actors who still don't talk to each other. So they've increased the number of actors. It's all taking place at the local level, but this coordination isn't taking place. But it might be easier. Simplified management because it's closer, it's not dealing with multiple different ministries, for instance. But there could very much be political interference, local level political interference as much as national level. People could start using staff that are supposed to be done for one thing and using them for other functions when the decision-making power is much more localized and there's not accountability to a higher power like a national government. Then you could start getting staff to do whatever you like with them. If you have a weak local tax base, when you've got, for instance, in northern Ghana, you've got a very sparse population. Northern Kenya has a very sparse population. Is there going to be enough of a tax base to pay for the services that are needed? One of the things that happens in Canada, because our East Coast is very sparsely populated, most of the Canadian population lives in 3 provinces. Our West Coast is not populated, and that's where most farmers are. Huge amount of farming in the West Coast. So we have transfer payments across the country. So the provinces that are more densely populated send money to the federal government, who then transfers some of it out to the provinces, because there isn't enough money from the tax base in sparsely populated areas to support what needs to be supported. So you've got situations like that. You lose economies of scale, the ability to buy collectively, for instance. There's less bargaining power, perhaps, if you've got a sparser population or a smaller group of people. Yeah? Weak local capacity, decentralization does rely on people having the ability to do at the decentralized level what they need to do. We can't assume that there is that strong capacity. It could be that, especially if you've got all the capacity held at a national level previously, how would there be strong local capacity? There are barriers to it. So if you've got everybody sitting in an office in Nairobi, and then you decide that actually all the decision-making power is going to be within each province, well, how would the people from Nairobi, how would their knowledge get to each individual province or state? It's going to be much more different. So Uganda has had a devolution from the district to to the district and the sub-county level. There's been partial devolution fiscally through local taxation and cost recovery and delegations to the National Agricultural Development Advisory Service. One of the things that I find dead entertaining in Uganda is how many acronyms there are. There's narrow and NADS, at least it's a little bit more simplified. Decentralization did not increase the number. This was happening within HID. Everybody had a short form. It was brilliant. In Bangladesh, there's been deconcentration, so you've got local level planning, but a central management of budgeting resources. And Uganda is a very interesting example of how this has been done. And if you are interested in devolution and decentralization, there has been a lot written about the Ugandan experience. Are they starting to re-centralize certain things? Because there's been a lot of shifts within NABS and NARA in the last little while, yeah?
When we talk about NABS, there was a weak research extension linkage. Right now, NABS is now located at the research institutes. They now have a zonal office. It's a shift from being based at the district far from research. And that's maybe improving the research extension linkage by being the same institute.
So it's bringing people together that were once, they were decentralized apart, now they're coming back together to improve the linkage.
Yeah.
Does that make sense? Patrick knows that. So we've got an expert in the results of deconcentration and decentralization. So what are the implications for thinking about who delivers what for other sectors? Things like nutrition and health education. So it's not just extension that gets decentralized, and it's not just the extension system for whom there are implications for how decisions are made. Could nutrition, could national health care have public and private parts? Who should pay for it? Different systems here, I mean, we have a nationalized health service here, but you pay for your prescriptions. In Canada, it's a national health service, but everybody pays the cost of their prescriptions. So you can have different kinds of nationalized health service delivery and different levels of paying. If you want to get an operation or have surgery done quicker here, you can pay to have it done privately. So it's the same surgery, same hospital, you pay for it if you want it done in one way, or you don't pay for it if you want it done the other way. I had an ear infection, and the doctor thought I should have tubes put in my ears, and I could have it done the next day if I went and paid $50, or I could wait 2 weeks if I wanted to go through the national healthcare system. I opted to not have tubes in my ears. I don't recommend them. But can things like health and nutrition education be delivered? And you start raising questions about family planning advice, the same sort of thing. You can have different levels of concentration and privatization and public service delivery. We have to ask questions too about who's now able to access services. The same thing with extension. Has decentralization and has more decision making at lower levels improved access to services? Has it not improved? When you're talking about family planning advice, a lot of people have very deep moral arguments for why one thing should take place or the other. Is this now making it more difficult to access? And there can be heavy regional differences in terms of quality, but it does have implications for other kinds of sectors. Does that make sense? Okay. So that's the end of last week. It's far less painful. We're not like mired in open access. The next thing we're going to do then is look at peer education. So I'm going to, because our head of school had the photocopier all tied up when I went to pick up my photocopier. I'm going to go to your handouts right now. I was going to give you graphs about sowing seedlings or something, but I thought I might try to